And there we are. Hey guys, welcome back to a Mending Naturally Autism Education Network seminar. And today we are going to be talking about COVID-19 and autism. And what do you think those two have together? I have to do it today with a PowerPoint slide because I'm going to show you some very interesting statistics. And, Mark Twain once said that there are lies, there are damn lies, and there are statistics. So I want to be very careful how I show you these statistics and where they come from, and perhaps even, how they correlate with what we're seeing in autism, so to speak. So one of the things that we keep hearing about is this unprecedented pandemic. And I thought I'd start out with giving a definition of what a pandemic is, and it's a outbreak of disease that occurs over a wide geographic area and affects an exceptionally high proportion of the population. In other words, there are more of them than you would expect to find. There's something that's called abnormal about how many people are being affected by this whole issue. And we also are being inundated with the COVID-19, which is a coronavirus disease discovered in 2019. And you may hear some other words like the SARS-CoV-2 virus. It's just the newest strain among 7 coronaviruses that are known to infect humans. And although more than 99% of people infected with this COVID-19 fully recover, there are a few cases that have some severe complications and result in death. So it's nothing to be trifled with. But the case fatality rate has been touted initially around 4 or 5%. And those mathematical models, I keep hearing about the models. I mean, here you keep hearing about experts who are wrong, and they keep going back to these experts for their next opinion, which is wrong. And this is an interesting statistic that just came out from the CDC. This was actually on 5/20, May of 2020, and said the case fatality rate is 0.26. And here are some case fatality rates among previous flu strains, and yeah, it is consistent with a severe flu, but not more, just a severe flu, and it too is going to pass. Now they say, well, what do the case fatality rates look at with respect to age? I mean, was it justifiable to close down all our schools? Is it our children who are going to be affected dramatically? Well, looking at 4 countries worth of data, like Italy and Spain, you'll see here that the fatality rate is pretty significant when you get into the 70 and 79 and 80-year-old range, pretty much close to zero statistically if you're under 20. Okay, so you have to sit there and wonder, why are we closing our schools? Why are we closing everything when we know who this is affecting the worst, who has the potential for the worst outcome? Kind of interesting, right? And then remember I told you back in February, March about vitamin D. And looky. This is the correlation between COVID-19 death rates and vitamin D levels. And as you can see, the COVID-19 death rate goes way down once you get your vitamin D levels above 30, and above 34 it almost goes to zero. So that's a very promising detail that we need more vitamin D. There's a lot of interesting hypothesis theories that the reason a lot of these diseases go through the late fall, December, January, February is because that's when people are indoors and they're not making vitamin D. But you and I know if you take vitamin D, you can circumvent that. And when you have a child with special needs, you're not sitting out between 12 and 2 in the afternoon in your bathing suit, okay? So, I mean, there's some practicality here. Now, listen, on Friday, just this past Friday, the CDC and prevention reported that the percentage of deaths in the United States has dipped so low that across the whole nation that it's actually dropping, if it drops any lower, it can no longer be called a epidemic. So that's really good news. This thing is on its way out. And then, of course, to substantiate that, this interesting chart looking at the death rates are going down. But what you keep hearing is now they change the tune that you're hearing. They're constantly talking to you about number of new cases. And, this may sound harsh, but as a physician, who cares? If it's just the cold and the sniffles, I don't care if there's 10,000 new cases. It doesn't affect anybody except it's the death rate. So in the light that we are having more and more new cases being picked up, the death rate's going down. And here's an interesting statistic showing that as of today, we've just broke the 3 million number for the United States. We have 3 million cases per 328 million Americans. 3 million cases, 328 Americans. Well, wait a second. That's under 1% of all of us have this or had it, because a lot of it have recovered. Less than 1%. It's going to tie into autism pretty soon. I can feel it. I know you know what I'm talking about when they talk about autism being 3% of our kids. This is going to go away. Autism doesn't go away. So I thought you'd kind of like that number there. But again, the death rate is dropping. Now, they look at the number of cases, and you keep hearing about the number of cases, but we're pretty much interested who's passing away from this, right? So they actually looked at the total number of corona cases as of July 8th, 2020 by state. And guess what? They may be talking about Florida, Texas, California having more and more, but the actual highest death rates are New York and Texas. Let's see here. The death rate still, New York and New Jersey are going to be still very high in that. But and this is per 100,000. So when you see a number of like 75, that's 75 per 100,000. So state by state, we're going to see definitely a drop. The top here is New Jersey. It got kind of truncated. Then New York, then Connecticut, Massachusetts, and also the numbers are definitely, as far as death rates go, in the Northeast. They have they get the award for that. Kind of wonder why, right? All right. So now we were talking about previously about the mask wearing. Public health experts keep changing their guidance on whether or not to wear the mask for coronavirus. On 3/31 of this year, the World Health Organization stands by recommendations to not wear masks if you're sick or not caring for someone who's sick. This is kind of what we wear in a laboratory when we're working with viruses, okay? So did we go from a total hazmat suit to protect your body from virus invasion to wearing the N95 masks properly, like we talked about last week, to just a bandana? There's a lot of interesting talk about what's going on there. So how much have we spent so far? The U.S. has thrown $6 trillion at the coronavirus crisis, the best I could tally today. $6 trillion. There's probably going to be more involved. I mean, remember, they moved the military. They started military bases with hospitals to help with overflows, and the tents and all the supplies and the respirators. And just engaging the military just costs tons of money. But $6 trillion is what I could find today as the total cost. So now we're going to talk about autism. And this is kind of interesting. The CDC.gov, this is where this comes from, says about 1 in 6 children, or 17% of children aged 3 to 17 were diagnosed with developmental disabilities. So it's not just autism, it's all developmental disabilities, as reported by parents during a study between 2009 and 2017. And this included the autism, ADDH, blindness, cerebral palsy, among others. That's 170,000 children per million. Now I queried, well, how many children do we have in the United States? Um, and per child stats, children between 3 and 17, there are 74 million. So if it's 170,000 per million, then 170,000 um, times the 74, you get 12,580,000 children who have a developmental disability. But as I say on TV, but wait, there's more, because I know we're going to home right into the diagnosis of autism, and I got something for you there. In 2020, CDC reported 1 in 54 children in the U.S. is diagnosed with autism, and they're looking at 2016 data because it kind of lags, so you'll wait till you see what 2020 is in a few years. But that translates into 1 in 34 boys identified with autism. That's 3%. 1 in 34 is 3%. With COVID-19 that got $6 trillion, it was less than 1%, and that's going to go away. One way or another, it's going to be gone, just like SARS and MERS. And as you know, as I know, autism painfully continues, like day after day, week after week, month after month. 1 in 34, that translates into 1,110,000 boys in the United States. That also means, of this year, for example, of all the boys born in all the hospitals in the United States, 1 in 34 in just a couple, 3 years is going to be diagnosed with autism. And that's pretty frightful to me. 1 in 144 girls, and that translates into about 257,000 girls with autism. They are less susceptible to developing autism. Keep in mind, guys, just to give you a point of reference, when I was in medical school in the early 80s, the autism rate was 1 in 10,000, not 1 in 34, not in 1 in 64, not 1 in 54, not 1 in 166. It was 1 in 10,000. So something's really changed. Now, the interesting thing is, I think I showed you guys this last week. It's the only reason it's changing from when I was in medical school to now is we're better diagnosticians. We're able to diagnose this better. And this shows that very clearly. Oops, let me get that centered for you. And look at that biggest peak, that's New Jersey. So apparently New Jersey has the best doctors to diagnose autism than anywhere else. They have the finest diagnosticians because they've got more autism there than anywhere else. So isn't that good news that I'm just tongue-in-cheeking here. Something's really changing because especially the younger parents and then parents from my generation when you grew up, we didn't have schools with special needs classrooms. We didn't have all these special ABA therapies and stuff. Yeah, there was speech delay, and of course there was hearing impaired, and of course there were the intellectually challenged, which we called back then mental retardation, but nothing like what we're seeing now. Okay, I mean this is just crushing us. Okay. Now, the next statistics from the CDC said that over the next decade, there's going to be somewhere between 700,000 and 1.1 million teens that are going to enter into adulthood. They're going to age out of school-based services. And when these teens tend to age out, pediatricians, just because they might be operating at a 6 or 7-year-old level, but they have an age of 18, they say, no more, we're not going to see you anymore. Probably because they're frustrated with them. But where are they going to go? I mean, who's going to see our 22 and 24-year-olds with special needs? And they were saying, hey, there's a definite problem with getting these kids health care. And then there's this big push to getting them to work. And they don't receive the health care, they stop seeing the pediatrician, and they remain unemployed or unemployable. I was looking at one statistic I'll show you here. 80% of the kids who are working are making less, or making about $160 a week, which puts them below poverty level. In other words, they're not going to be able to self-support themselves. They're going to require a form of assisted living. And if you've ever seen or been involved with the cost of assisted living with our senior citizens, $4,000, $5,000, $6,000 a month, I mean, that gets really, really expensive. So anyway, nearly half of 25-year-olds with autism have never had a paying job. Okay. So the cost for caring for Americans with autism has reached 268 billion in 2015. That was 5 years ago, and they were projecting then 461 billion dollars by 2025. And of course, that number is going to go up as the number of children who are 12, 13, and 14 now who are being cared by their parents in 10 years are now, 22, 23, 24. So now we're talking about the cost of taking care of these adults as being about 200 billion a year compared to 60 billion plus a year for kids. So we've got a real problem with costs. Now, here's where I get a little bit irked. We just spent $6 trillion on something that was going to go away no matter what we did. So just because these numbers are staggering, $1 trillion equals 1,000 billions. We just spent 6 trillion, okay? So that was 6,000 billions. It's kind of weird, right? So we just spent $6 trillion on something that was going to go away no matter what we did. Taking care of adults only costs 200 billion a year. So 1,000 billions, 1 trillion, would cover 5 years of care for these guys and gals. And of course, if we spent 6 trillion on this, that would have been 30 years of services for these guys. Let alone, you don't just carve out services for them. How about research? Can you imagine what you can do with $1 trillion? $1 billion. How about $100 million for the research, the investigation, trying to come up with new therapeutic interventions, figuring out what's causing all of this and getting down to the brass tacks and saying, we got to stop this. Whatever it is that's causing this, we got to stop it. Anyway, and just think about what you've been going through the past 3 or 4 months with these kids at home. So that's kind of, in a nutshell, how I wanted to show you how we're moving money. Now, there was absolutely no problem at all finding $6 trillion to take care of a virus that was, like I say, like any other flu virus or whatever, was going to go away anyway. I mean, I'm glad that we were able to do that. This suddenly popped up. This was kind of scary at first. We didn't know if this had been weaponized. We didn't know who it was going to really take a toll on. Was it going to fill the children's hospitals with very sick pediatric patients? Or, well, we now know. We now know who it affects, who it doesn't affect, how it's spread. We know that it's aerosolized. It could be droplet too. We'll give it that. So that's where we have a real problem with how funds are being allocated for taking care of this virus versus taking care of autism. Okay, so now we're going to go to your questions. And, very often what I've been hearing is, like even today, so does that mean that we don't have to wear gloves when we go to the grocery store? Yeah, it's not going to help. Research that I looked at earlier this week suggested that these viruses are actually aerosolized, which means they're going to go around the air conditioning system. You stay in hotels that don't have windows. They're so small, they'll go, like we talked about last week, through the masks, around the cracks in the masks, the venting of your masks, it's going to get around in there. So that was one particular issue. All right, so let's see. We don't have any. Are they coming up? Or questions in there or not? Okay, so we're going to wait for some questions to populate into the Mending Naturally scorecard here in just a minute. And the other question that I'm asked a lot about is, were children wearing masks? Is that good or bad? And you have to follow your state, your county, your city's guidelines. In other words, if they say children have to wear masks and they have to be 2 and up, I mean, you have to follow the law. I mean, that's what it's all about there. But the question is it really doing anything except aggravating you and aggravating the child? And it's not. You're not going to get a well-fitting N95 mask on a child. And we already learned that even if the children get the virus, it's not a big thing. So why put them through all the pain and the torture of having to wear a mask when they go out, when they go to the pool, when they go anywhere? Okay, so let's see here. What have we got? Lisa says, thanks for the common sense and factual information. Yes, Lisa, thank you. It was kind of fun to look at these. These are statistics that you're just not going to see on the major news networks, because they don't go along with the narrative of what they're trying to present, the fear they're trying to project on you. And I think a lot of the mask wearing is an approach to make you feel like you have some control over an uncontrollable problem. In other words, we're afraid of the virus boogeyman, but if I wear my mask, I'm in control. It's kind of lucky charm. You know, when I was a kid, back in some sad to say, but in the 50s and 60s, we actually carried around rabbit's feet. They were actually rabbit's feet, and they put on a keychain, and we thought that was good luck, and that was pretty exciting to get a rabbit's foot. We were easily entertained back then, by the way. So is this any? I think the next idea is, well, what if it just slows down the spread? Well, if it's working and it's just slowing down the spread, we're all seeing the results of that. I mean, this thing's just going on and on and on. When's it going to stop? 5,000 more, 10,000 more. We got a lot of people in the United States who have got to get exposed to this, so this might continue on. Okay, so, and let's see, one of the questions here from Joe Marie is boosting the immune system. Really easy to boost the immune system for all of us. You saw the vitamin D statistic, so we should all be taking vitamin D3, okay? And for adults, 5,000. I have in my notes elsewhere about how to dose our kids from 1,000 IUs a day, 2,000 depending on weight. But I'd say if you're a child from 1 to 3, you can definitely have 1,000 IUs a day. It's usually a drop. Our vitamin D3, it's 1,000 IUs per drop, not drop or full, just a drop, right on something that they're eating. You don't want to put it in their drink because it'll spread. After about age 4, we can go to 2 drops. I measure their vitamin D levels. Whenever I draw blood, I get a vitamin D level. I optimally like to keep it around 80, so I can kind of keep track of that. Adding zinc is very, very helpful, and of course good old-fashioned vitamin C. Those have been really, really helpful in helping your body take care of the virus like it normally does, but not get too involved with it and become what they call enhanced. It sounds good when I've got an enhanced immune system, but when they talk about an enhanced immune system, they're talking about like when somebody who's allergic to eat peanuts and they have an anaphylactic shock, they're having an enhanced immune response. Not so good. So what seems to be a major cause of death is people's responses are abnormal, and it's going after the virus, but then they get this weird enhanced immune response and they just clog up their lungs, and it's not a good thing. So anyway, 4 things: vitamin A, vitamin C, zinc, and vitamin D, and you are in great shape. Okay. Let's see. And then Alana says, what about everyone that says we should wear masks to respect those immune-compromised issues? Guys, if I was immunocompromised, I'd be staying at home. I wouldn't be going to a stadium. With the way they deliver food nowadays, if you're, like for example, we had some friends who had a 90-year-old papa staying with them. He didn't go out, or if he did go out, there was nobody around him. Why would you do that? When you're 80 or 90 or you got a compromised immune system, you always have a compromised immune system. That means if it's not this particular virus, it's the flu. If it's not the flu, it's something else that they're going to catch. It's like you have to be very, very careful when you're immunocompromised. Wearing the mask hasn't shown that it's going to help immunocompromised people any more or any less. And but I can tell you that, and I do take care of a lot of children who are immunocompromised. I mean, they're getting IVIG every week, every other week. They do have to be careful of this. I have children who have cardiac defects. They have lung defects. Absolutely, they have to be. But whether I wear a mask or not is not going to affect their outcome. Their outcome is going to be affected by uh, common sense. Parents don't go to crowded places with them. I mean, even in the middle of summer, it's not a good idea to take an immunocompromised child to Disneyland or Disney World. It just doesn't make sense to do that. So I'm kind of careful with that. You don't shut down the economy because, well, we've got immunocompromised people. I think immunocompromised people can bolster their immune system too. They should have it actually identified and quantified what they are more sensitive to. Are they really sensitive to viral infections, or are they more sensitive to bacterial infections? And what kind of infections? So if you're immunocompromised, especially if you're in my clinic, you know exactly what you are more susceptible to and not. Good question. Why do some people get so sick? My son was a preemie with premature lungs. Is he at high risk? It depends if the premature lungs are no longer preemie lungs, or if they got scarred and they have and they're prone to wheezing and asthma. The pulmonologist would be able to tell you if they have made it through that preemie time. And then, did we affect or impact the immune system with something environmental? And some of my moms will say environmental is vaccines, or other people will be talking about the sprays that they put on our products, like the pesticides and the herbicides and the mercurials and things like that. So there are a lot of things out there that can affect us and impact our immune system negatively that are not necessarily infectious disease. Okay, our cleaning agents that we use in the house, and then you start talking about cell towers and all that kind of stuff. So you get into energy medicine and all. So there's a lot of things, but I would probably say that if you had a child with preemie lungs, sooner or later you want to make sure that the lungs are basically now recovered, repaired, and the same as anybody else's lungs, so you're not always worried about that problem. On the other hand, if you said, well, my child's got chronic wheezing, if he catches a cold or sees somebody who has a cold that's 5 miles away, they're going to start wheezing or croupping or something, tracheomalacia, structural defects and things, then yeah, we got to be real careful with those kids. We don't want them to get sick with a cold. A cold can put these kids in the hospital with breathing treatments and stuff. So it's just it's a problem that we have to consider. Okay. And yes, Amy, a tiny drop. Okay, and let's see. Lisa says it makes if masks work, why 6 feet? And if 6 feet works, why masks? And masks works, why lockdowns? And on it goes. And you're seeing the disjointed information. If the World Health Organization says one day no masks are needed, why the next day do they say masks are needed? And then somebody, yeah, so you're getting a lot of information. I think there's a narrative out there that's driving this, or multiple narratives that I'll let everybody offline debate how much of this is political, how much of this is driven by big pharma to develop vaccines so they can sell billions more. You know, they scare the bejeebies out of you. I mean, for example, guys, if you sold these little beauties when you want everybody to wear masks, and you know, the pharmaceutical companies have big lobbies and stuff like that. Surely when you go online, you can see there's no shortage of people selling masks with funny faces, and then they got the welder stuff, the blast shields, of course, which does nothing with laminar airflow around and around. They protect you from getting sprayed on, but if it's in the air, it's going to go in and around and stuff like that. So there are a lot of interesting theories on how this is why this is being propagated to the level of that it is, and the fear that it generates in people, to where they're wearing hazmat suits while they're driving their car. You know, it's just a virus, guys, and our bodies are equipped with an immune system that knows how to fight viruses. And you know, people will say, well, your body's never seen this virus. Well, I got news for you. When babies are born, their body's not seen any viruses. And they're going to have to develop an immunity with each cold that comes along. And if they are the third or fourth child in line, that means they got a 2-year-old brother and a 4-year-old sister and a 7-year-old brother and they're going to bring home everything from school. Oh no, they're not going to school anymore. Well, you know what I mean. These newborns are going to catch everything and build their immune system. So everything to a 1 year old, to a 6 month old is brand spanking new. And thank God they've got an immune system that can figure it out and make it a cold, and it goes away, and you're miserable and you're sucking the snot. There's nothing like taking care of a 2 month old with a nose full of snot, right? I mean, those are obligate nose breathers. They have to breathe through the nose. They know they can't go like this. They have to breathe through the nose, and you're constantly with the squirter. It's terrible, right? Okay. But we get through it. We're human beings. We get through it. And this was going to be, since it wasn't weaponized, it wasn't messed with in the laboratory that we know of so far. You know, the when they look at it closer later on, they'll be able to say whether this is a wild type or something that got Mickeyed with. But anyway, it's just, if we go on the down the line, that it's just another virus that our bodies have an opportunity to say, been there, done that, and we don't get bothered by it again. You know, the other thing too is that these viruses, they change and change and change as they get spread. You know, the virus that starts on the East Coast is different by the time it sweeps through on the West Coast and all. And they tend to become less virulent. In other words, I think that's why so we're seeing the death rates go down. So either A, we're getting smarter, we're not putting everybody in a ventilator because that will kill them. B, people are starting taking their vitamin D and vitamin C, and they're getting it, and it may be kind of obnoxious, but they're not dying from it anymore. And then, of course, the recovery rates. All right, let's see if we got any more questions. It's politics driving this and big pharma. Well, there's certainly something big and powerful behind it, and it's probably on multiple levels, from mayors and then to governors, and there's other motives behind all of this stuff, and that's what books are written about, and it's kind of intriguing. I'm just more interested in how we're going to keep my patients safe. And you know, it's kind of funny. I have not had, and we even asked my patients in Italy, I've not had one child on the autism spectrum get COVID-19. So it's kind of interesting that with all of this, my patient population, nobody's had it. And I do not recollect whether I've even had a parent yet had COVID-19 in my sphere of people that I know. So it's not that common in the autism community, and I'm sure people will write and let me know that's not necessarily true, and I'll be enlightened, and I'll let you know next week. Okay, so Jenny asks, is there a chance that this COVID-19 starring was China's 2019-29 flu shot and it shed? I've read about those different theories about whether this was actually in the flu vaccine and it was inadvertently put there, or part of the vaccine manufacturer and this is an offshoot of that stuff. I don't know if we'll ever know the truth. I mean, if you did that and it was your company, you certainly wouldn't let that out. So I don't know if there are going to be people who are going to dissect the flu shots to find out what was actually in there and say, aha, this was a complication of this last year's flu shot or not. There's all kinds of theories out there floating, and like I say, they're intriguing. I'm more interested in making sure that the children I have the honor to take care of are well treated and as bulletproof as possible to these diseases. Because once this one passes, you know, when you get kind of when you've got a lot of years behind you, there's something else coming. It'll be here next year, or the year after, or 4 years from now. There's going to be, these things wax and wane in their severity, whether it's the respiratory syncytial virus or it's, you know, the whooping cough, worse years. It's kind of like locusts. There are some years where you don't have any locusts, and there's some years where they're devastating everything, like they are right now in China. Things come and go in cycles, and there's going to be something else, and I'm just hoping that we don't overreact again, causing this much pain on our families with job losses and not having enough money to make mortgage payments and electric bills. I mean, this has been really hard on a lot of families. Not to mention having kids at home that we've talked about before, how stressful that is, where moms now have to be teachers and and this distance learning that us old guys used to call homeschooling, but of course everybody hated homeschooling, so we call it distance learning, and that's okay. All right, let's see if we got time for one more call. We are taking vitamins and our gut is healthy, so we are okay. Thank you so very much. Yeah, that's pretty much what I hear, that if you just use some common sense, that you're going to get through this just fine without any of those severe complications. But the elderly and people who are immunocompromised have to be more careful with this and anything else that's infectious. All right, so that is the end of our talk today. I hope you learned a lot from these interesting statistics that are coming out. More will come. These are not something that you're going to be seeing on the nightly news. They're not going to say good news, the death rate's down, even though cases are up. Not to worry about it. They tend to be minor and asymptomatic, and we're going to be opening up. That's not what you're going to hear. They still really like to sell things with fear. Keep that in mind. That's how you sell things. It's always the end of the world. People love and respond to end of the world scenarios, and they sell things with fear. And you just have to be careful whenever you hear something about someone's going to die. You have to look back at what's going on here and maybe even watch that money trail. All right, guys, have a great week. Enjoy the kids. Hopefully we'll be able to get rid of these suckers, okay? And start enjoying getting outside, getting some sunshine, make some vitamin D outside. I have a lot of the kids now going out to their pools or their neighbors' pools and stuff like that. Let's get some vitamin D naturally. Let's take some vitamin D. Stay well, eat a good diet, guys, and we'll see you guys next week. All right, take care. Bye-bye.